Good afternoon to everyone. I am Elango from Trichy. I think this video will be helpful for the nursing students, those who practice obstetrics. So nursing students should be able to understand when they examine the cases. The pregnant women may have a lot of risk factors. Let's see the list of risk factors with the pregnant women in these videos. Almost all the videos are 10 minutes, less than 10 minutes video. You can watch it. The German measles, that is called rubella virus, which is may be transmitted through the placenta. 8 weeks itself, this is more contagious one, highest rate of maternal and fetal infection. German measles. Next is a sexually transmitted disease. On the aspect of syphilis, the syphilis crosses the placenta, the syphilis is causative organism is Treponema pallidum. The Treponema pallidum crosses the placenta, leads to spontaneous abortion, increased incidence of mental subnormality and physical deformities too. Because of the syphilis, the baby may born with a mental subnormality. The genital herpes may cross a placenta. So it may cross the placenta. Herpes caused by herpes simplex. The fetus is contaminated after membrane rupture or with vaginal delivery. So actually sometimes the herpes crosses the placenta. If it is not crossed, if the mother has this infection, at the time of after the membrane rupture, that infection spread into the fetus at the time of delivery or at the time of vaginal delivery. That fluids and infected materials may touch the baby and which causes herpes. Next is gonorrhea, is the most contaminated at the time of delivery. It is postpartum infection of the neonate. This causative organism is actually the Listeria gonorrhoeae, like ophthalmic neonatal pneumonia and sepsis. After the delivery of the baby may get these many infections. Next is human immunodeficiency virus. This is transmitted through blood products and other bodily fluids such as urine, semen and vaginal fluid. Repeated exposure to the virus can increase the transmission to the fetus. Usually this human immunodeficiency virus may not cross the placenta, but if the mother has an overload of virus, if the mother getting repeated infection and repeated exposure to the virus, and this virus get overloaded in that woman, and that may cause cross of infection through the placenta, and fetus may get this human deficiency virus sometime. Substances abuse, this cross placental barrier. These are all the substances that crosses the placenta. Alcohol, cocaine, marijuana, amphetamine, barbiturates and heroin. So the pregnant woman should not take these many substances. High risk for mother is fetal growth retardation due to these many substances. Sometimes abruptio placenta and fetal bradycardia is common. Consumption of alcohol causes fetal alcohol syndrome. Because of the fetal alcohol syndrome, the baby may have a jitterness, physical abnormalities, congenital anomalies, growth deficient sometimes. Because of the excessive smoking of the pregnant woman, which causes low birth weight of the baby, higher incidence of birth defects and stillbirths sometimes. So physical signs of drug abuse, not necessary. Adolescent pregnancy. Sometimes the adolescents may get pregnancy because of early menarche sometime, changes of sexual behaviors or family problems, and poverty also sometimes leads to adolescent pregnancy, and lack of knowledge of reproduction and birth control which causes adolescent pregnancy. So when the woman is pregnant, there are many factors are important to take care of that woman, and which causes many problems for the particular pregnant woman. So that major concerns are nutritional status of the woman is important. Emotional difficulties and behavioral difficulties are taken care by the medical people, and sometimes the pregnant woman may not have better support, family support or social support. That also takes some risk. An increased risk of stillbirth for the few women. Low birth weight with a newborn infant is very common in India. So fetal mortalities are also unusual, but it is unusual fetal mortality. But we should take care. This is taking major concern over this. The cephalopelvic disproportions. This confirmed cases may go for the LCS. So we have to reduce it in order to prevent the cephalopelvic disproportion. You have to take care of the patient from the beginning. Increased risk of maternal complications like hypertension, anemia, prolonged labor, and infections are to be taken care by the doctors and nurses. Early detection and correction may give better birth of the baby. These are all some high risk factors that we have seen. So thank you so much for the listening.